Have you ever wondered if you can or even should stretch a nerve? Today in this video, what I want to do is talk about the difference between stretching nerves and stretching muscles. But before we talk about the difference, let's talk about what the nerve does and what it might mean to stretch the nerve. So nerves are like these slippery wires that run through our body. They just carry the signals that give information from our brain and tells us to move, and or information or signals from our skin and the rest of our body that says, hey, something hurts or something feels good, and we perceive that in our brain. Nerves have the ability to do two things, and this becomes really important when we're trying to understand, how to stretch a nerve, if we should stretch a nerve. Nerves should have the ability to elongate a little bit. So they've got some stretch or elasticity to them. They also have the ability to slide through tissues. An example is right at the spine there where the nerve comes through the spine. It has the ability to do a little bit of movement where it slides. For those two reasons, most of the time, you're not going to be able to stretch a nerve unless you have an injury. And that's where this video is going to be relevant to you if you have an actual nerve injury. That can be you sprained or strained something and that nerve got very inflamed. You did something where you really stretched a nerve quickly. Maybe you have a disc bulge. That's one of the more common reasons that somebody would have a nerve injury and nerve inflammation is from that disc bulge in through there. And a classic example of what a nerve feels like to be stretched, for some people, when they put their socks and their shoes on in the morning, if they've got a nerve injury in there, what they'll describe is, I try to put my socks and my shoes on and it hurts so much back here. And the reason for that is because that nerve that should have that ability to elongate a little bit and stretch, in that region where the injury is, it's actually that inflammation kind of caused it to get condensed, and it lost its ability to do those two things that it should be able to do. It lost its ability to stretch, and it lost its ability to move through that area. So when we stretch the rest of the nerve, let's say it's bunched up right here, and then when we go to do this here, we're putting that stretch on. It's tugging and pulling at that point of the injury. Now, the same thing can happen in areas of the neck and other areas of the body. I'm just using this as an example. This is kind of the classic example of what can happen and cause that pain in through there. Now, if that's happening, you do not want to do your traditional stretches that you would do for a muscle. A lot of times our muscle and our connective tissue stretches are, let me go into a deep stretch. For some people it feels good. For some people that aren't used to stretching, it feels like a dull ache maybe. But at the end of it, most people will say, I feel good because I did that muscle stretch. With a nerve, if you do a sustained stretch where you hold it or an aggressive stretch, sometimes what happens is the surrounding muscles in that region almost want to get more tight on you. It becomes more aggravated. So you're going to want to choose a different technique. And there are these techniques, some people call them nerve mobilizations, nerve flossing, nerve glides. So all of these terms are kind of saying the same thing. So let's talk about how we would do some of these nerve glides and these nerve flossing techniques in through here. There are two ways to do it. The first way I'm going to show you is meant to try to improve the sliding or the gliding of that nerve through tissues. And to do that, what you're trying to do is to put tension on one end and then slack on the other end. So it could look something like this here. I'm going to do this stretch where I've already got a stretch because my hips flex like this. When I bring my knee like this, and especially when I bring my foot this way towards my body, people with nerve tension might feel it back in through here. And then usually, if they look up, they'll say, oh, that actually kind of relieves that there. So what is happening is there's tension on this lower part. As you look up, you're putting slack within your spinal column, your spinal cord. So I've got tension, but I've got slack. Then you could go the other way. Now I'm going to bend my knee, put that back down. Now I've put the slack here. Now I could just bring my chin to my chest. And notice how I just rounded just a little bit through my mid-back. I'm not slouching so much. Really, the first movement is chin to chest. and then pull that down a little bit. And then you would go back and forth. We would go tension here, I would look up. And these are called nerve flossing or nerve gliding techniques. How many would you do? It really depends on the severity, depending on what's going on with you. But for a lot of people, it's about a dozen. Maybe it's 6, 7 times, maybe it's 12 or 13 times. And you want to do those fairly frequently as long as it's not creating more of a response or an aggravation in through there. So let's talk about technique number 2, and that's going to be your nerve tensioners. So a nerve tensioning is I'm going to put tension on both ends. This is usually done in the later phases. So if you do have an injury right now and you kind of have some of this stuff going on or you suspect, be very careful with this one here. So with this one, what it would look like is I'm going to tension here, just like I said. So I'm going to extend my knee, bring my foot this way here, and now chin to chest. And that might cause a really big pull in here. Do not hold it long. The idea for this one is maybe you hold it for between 2 and 5 seconds and then come out of it. And then when you're ready, do it again, and you would do several passes of that. Again, I cannot stress enough, if this is aggravating anything, it's not for you. But the idea with this one here and what's happening with this is as you tension the nerves in through there, you've got to think you've got all kinds of vascular bundles, a lot of circulation that feed the nerve. And so the idea with this one is as we're kind of tensioning and letting off, it's acting like a pump. I'm tensioning the blood vessels in through there. And then when I let off, it's kind of giving some spurts of blood or oxygen, glucose, all of the things that your nerves need to survive. So I'm doing that and then letting off. And so it's kind of like you're pumping. It's a pumping mechanism in there to help it heal. So those are your 2 different ways that you can stretch nerves, or I should say floss or mobilize nerves. And again, just to reiterate, you do not want the long aggressive stretches for nerves. You want to be nice and calm with these. If you have an injury, you might want to see a specialist. Find somebody that can help you out, because although I showed you a couple of ideas, there are so many other therapies that might be valuable, some rehabilitation techniques. There might be some adjusting alignments that you need to do, some traction or decompression. So there's a lot of different things that might help. But here's one idea, and at least to give you some insight into the difference between stretching a nerve and stretching muscles and connective tissue. If you have questions, leave them below. If you have recommendations or something you want to learn more about, let me know. I like making videos for you. If you want more information about our practice, to contact us directly and have us work with you, feel free to find our information in our profile. We'd be more than happy to work with you.